In CPT coding, one of the most important concept we need to master in order to code surgery charts is surgical package. Other name for surgical package is global surgical package. So if you know how to use global surgical package and what are the things included in global surgical package, you are able to clear your CPC certification, and also you are able to clear your same day surgery interviews, and also you are able to perform well during the same day surgery live coding. So global surgery package is one of the most important concept for interview process. If you go to any same day surgery interview, minimum they will ask 3 questions related to global surgery package. So today's our topic is CPT coding, surgical package, common interview questions and answers. So in this session, we are going to learn answers in the question and answer format. If you are visiting for the first time, please click on subscribe button to receive future updates related to medical coding. If you want to know common interview questions related to same day surgery and also global surgical package, please watch this video until the end. And if you like this session, please click on like button in order to motivate me to provide more valuable videos related to same day surgery interviews. If anyone looking for APCs, local chapter webinar links for pre-CUs, medical coding jobs in India, USA, UAE, join in our WhatsApp group. Group link is in the description of this video. So without further delay, we will start our learning process now. Our first question is, what is CPT surgical package and what is included in surgical package? So what is surgical package? A surgical package is a set of services related to a surgical procedure that are included in the CPT code. So basically each and every CPT code is having the surgical package. So each and every procedure have few common things physician needs to perform. Those are included in each and every CPT code. And in surgical package we are having 3 stages. First one is preoperative stage. Second one is intraoperative service or stage. Third one is postoperative service or stage. So preoperative stage includes local infiltration, metacarpal, metatarsal or digital block, topical anesthesia, as well as subsequent to the decision for surgery, and also one related E&M encounter on the day of surgery or prior to the surgery. Intraoperative stage includes actual performance of the surgical procedure or the date of procedure where physician will perform the original procedure. So postoperative stage or postoperative service includes immediate postoperative care, which includes dictation, postoperative notes, talking with patient, talking with family, and talking with any other physician related to patient's condition. And this postoperative service include writing orders and also evaluating patient in the post anesthesia recovery area, as well as typical uncomplicated postoperative care. And before going to learn this question, we need to understand we are having 2 types of surgical package. CPT is having one surgical package as well as Medicare is having another surgical package. So if you want to work in the same day surgery coding, you need to understand the difference between CPT surgical package as well as Medicare surgical package. So in first question, we have learned about CPT surgical package. Now we will learn Medicare surgical package. Basically Medicare means here CMS surgical package. So in Medicare surgical package, preoperative service as well as intraoperative services which are included in the CPT surgical package are same. Only the difference between CPT surgical package and Medicare or CMS surgical package is postoperative care. Based on theory, Medicare surgical package is more expensive than the CPT surgical package. So what are included in Medicare surgical package? All additional medical or surgical services required for the physician unrelated to complications, where physician does not need to take patient into the operating room. Follow-up visits that are related to recovery from the surgery. Post-surgical pain management. So if we check in CPT surgical package, post-surgical pain management is not included, but whereas with Medicare surgical package, post-operative pain management is included. Few supplies are included in Medicare surgical package as well as dressing changes, local incision care, removal of operative pack, removal of cutaneous sutures or staples, wires, tubes, drains, all are included in Medicare surgical package post-operative stage definition. Next question is, can you code surgery CPT code along with E&M? Yes, we will code surgery CPT code along with E&M if the physician performs any minor procedure which includes 0 and 10-day global period, and also if the physician performs significant and separately identifiable evaluation management by the physician. Here the most important thing we need to remember this: physician needs to perform separate procedure as well as separate evaluation management related to the patient's condition. Next question, which modifier you can use with the E&M when you want to report a procedure with E&M code? So basically for E&M we are having majorly two modifiers. One is 25 modifier, one is 57 modifier. We will use 25 modifiers for 0-day global period as well as 10-day global period. We will use 57 modifier for 90-day global period procedures. Next question, do you have any idea about Medicare guidelines related to surgical procedures? So basically Medicare differentiate between major and minor surgical procedures. As we have discussed previously, the surgical package for major surgical procedures which is having 90 days does not include the initial consultation or evaluation by the surgeon to determine the need for surgery. Because of that reason, we need to append 57 modifier to E&M code in order to code 90-day global period procedure along with E&M. And as we have discussed previously, for minor procedures for Medicare, we are having 0-day and a global period. So 0-day and 10-day global period for minor procedure for Medicare patient. How do you report post-operative suture removal for Medicare patients? So for Medicare patient, suture removal for simple laceration repair is not bundled in the repair codes. So we need to code suture removal separately for Medicare patients. So basically this is based on the client or insurance payer. Next question, will you report 15853 or 15854 for removing sutures or staples in the emergency department? Yes, if we check the descriptions 15853 or 15854, these will be not needed any type of anesthesia. So you can code 15853 or 15854. Next question, how do you report non-Medicare patient visit for suture removal or other follow-up care and wound checks? So here the question is, how do you report suture removal or other follow-up care for non-Medicare patient like private or commercial insurance payer? So how do you report suture removal for commercial patient? So basically here the answer is, if your insurance payer adhere to CPT coding principles, suture removal is included in the surgical package as if there is no post-operative complication. So here non-Medicare patient, you don't need to code suture removal if there is no complication. Next question, how do you report follow-up care and wound checks for Medicare patients? For Medicare patient, wound checks following simple wound repairs are separately billable as these repairs are having the global period of 0 days. Next question, does ICD-10 code affect suture or staple removal or follow-up care? Of course, whenever you want to code suture or staple removal or aftercare or follow-up care for an injury, we need to use the 7th character with D for subsequent care for suture or staple removals. Next question, will you code for digital blocks? So answer is, the payers who are following CPT guidelines, these digital blocks are included in the surgical procedure, so you don't need to code separately. And under Medicare Global Surgical Package, digital blocks have always bundled when performed in conjunction with another procedure. So in the or during the procedure, if the patient use these digital blocks or not is not an important criteria, as these are defaultly included in global surgical package for Medicare as well as CPT global surgery package. Next question, how do you code other nerve blocks or trigger point injections? So the most common nerve block we will encounter in emergency department is dental block. So dental, femoral and hematoma blocks are common and these are separately reportable in emergency department coding, and we need to use these blocks along with E&M level. For trigger point injections, we need to check the payer guidelines, and also trigger point injections are separately billable procedures. Next question, where do you find Medicare surgical period for a CPT or HCPCS code? So if you want to check surgical period for any CPT or HCPCS code, you need to check National Physician Fee Schedule Relative Value file, which is available in the CMS website. So using this file, you can search the CPT code and its surgical period. So thanks for visiting our channel. If anyone looking for same day surgery coding training, please send WhatsApp message to 707-526-3939. And also, if you like this session, please like, comment and subscribe and share with your friends.